Dr. Scholz, we have a prostate cancer helpline, as you all know, and I'm just making sure that the patients know about that they can call and ask questions. A lot of the questions that we're getting are men who may be newly diagnosed or they have symptoms and they're kind of wondering, I have these symptoms, do I have prostate cancer? And oftentimes, as we've talked about, it can be a large prostate, an inflamed prostate, or an overactive bladder. So helping men kind of differentiate between these types of symptoms and figuring out the situation, let's talk about big prostates for a minute. So a man has urinary issues, he's coming into your office, and what is your first conversation like with him? You know, what are you looking for as far as symptoms to determine that it is a large prostate?
Yeah, it's always good to remind people that prostate cancer itself, thankfully, does not cause any symptoms. And this is why we do PSAs and scans to assess the stage of the cancer and give people appropriate advice based on their stage. The issue with big prostates and symptoms, which you already pointed out, can be not only from big prostates, but from inflamed prostates, we call that prostatitis, or from overactive bladder, which we can go into in more detail perhaps in another video. But big prostates are problematic because at some point they can start to press on the urethra, which is the urinary passage that goes from the bladder through the prostate and out the penis. And with that enlargement, it sometimes constricts the outflow of urine and causes slow urination, incomplete bladder emptying, and sometimes if the bladder's not emptying completely, you can get frequent urination and whatnot. So what do we do for that sort of thing? It is very responsive to medicines that can relax the urethral passage. It's a muscular tube, and so-called alpha blockers, medications like Flomax, Rapaflo, Uroxetrol, almost immediately cause a relaxation of the muscles in the wall of the urethra. And within 24 hours of starting these medications, men can notice a big difference in the flow of urination and improvement in symptoms. These medicines are generally inexpensive and well tolerated, and as I mentioned already, their almost immediate effects allow people to determine if they're going to be helpful.
What type of side effects should we expect from these types of medications?
In some people, no side effects whatsoever, but because they do relax the muscles in the wall of the urethra, they can also relax the muscles in the wall of the arteries, and in certain cases, lower blood pressure. So if blood pressure were to drop excessively, then people get a little bit lightheaded. And certain individuals can't take them for that reason. The other side effects that we can see are with relaxation of the urethra. When men have an orgasm, the semen sometimes will not be directed out the penis as it normally is, but up toward the bladder. And so men can have dry orgasms. All these side effects are reversible with the discontinuation of the medicine. So if for some reason these side effects are considered intolerable, you can just stop the medicine, try a different product. But for the most part, they're well tolerated, effective, and can be used long term. They've been on the market for decades now, and we're not seeing any cumulative effects. If you look at interactions with other medicines, because they can lower blood pressure, if people are already on blood pressure medicines, then you could get excessive lowering with the combinations. For example, if you take Cialis, which also can relax the urethra and the muscular walls in the arteries. So Cialis plus Flomax can sometimes cause further lowering of blood pressure, which is manifested by lightheadedness or dizziness. So all these are rapidly reversible if you stop the medications, so people just need to be aware of them and adjust accordingly if they do start to see any of these side effects.
So once someone has stopped the medication for those reasons when it comes to low blood pressure, how long till those side effects last?
Probably 6 to 12 hours. It's usually pretty transient, so you have to keep taking the medications daily to get the benefit. And of course, if you were to have those side effects, they'll wear off quickly as soon as you stop the pills.
So when you say that, some of these pills are very successful at relieving these issues, what does success look like for a patient? I know it differs between patients, but what would you like to see in a patient?
Well, the people with big prostates may or may not be complaining about getting up a lot at night to urinate, but almost universally they complain that the urine flow is very slow, or they may have to be pushing or straining to get the urine out. They may have stopping and starting when they urinate. And so those sorts of symptoms, if the alpha blockers are going to be effective in that individual, are almost immediately reversed. And it has a sustained effect as well. So it's not something that you take the pills for a while and then they stop working. They continue to work indefinitely. If they're going to work at all, people can stay on them and they maintain effective flow of urine indefinitely as long as the pills are continued.
So when a patient's having these symptoms, are they getting this medication from their family physician, or do they have to go seek a urologist?
Any physician can prescribe them, and it's not unreasonable for family doctors to intervene in this sort of thing. So much of what we do to try and improve these nighttime urinary symptoms or slow urination is trial and error. And when you have relatively safe, innocuous medicines that you can venture a trial, see how it works, and then if they don't get rapid improvement, move on to some other alternative.
Thank you so much for watching, everyone. One of the biggest passions PCRI has is to empower patients, because not only does your treatment matter, but your quality of life matters. We know that the more research that you do, the more empowered you are. There's a ton of resources out there to learn and to garner information from in regards to this research. And we just want you to know that PCRI.org has the host of it. There's other advocacy organizations like ours who have lots of programs to help educate you on very specific topics. There's support groups and so much more. You can subscribe to our YouTube channel as well and stay up to date with all of our videos. We just want to empower you as much as we can. We thank you for your trust, and it's an honor to be able to serve you. We hope you have a great week.